Welcome Virtual Therapy Team. This training video will provide the PSR's experience scheduling telephone encounters as well as virtual visits. A few items to consider to provide an exceptional patient experience. A good environment includes one that starts with a clean camera lens as well as a good camera angle. You want to ensure adequate lighting in your workspace and one that's free of clutter around you. Please silence any personal phones or devices, and you can also make eye contact with your patient by looking into the camera lens. As always, we want to ensure professionalism by wearing our Spectrum Health polo and having the Spectrum Health backdrop in the background. Please have the following applications and programs running prior to the start of your visit with the patient: Microsoft Teams, MedBridge, Spectrum Health Now using Google Chrome, and Epic. In this first section, we will view how the PSR schedules a patient. The PSR will use the Rehab Virtual Visits DAR report to access the virtual visits and generic provider schedules. Please ensure you complete this one-time setup for the new DAR to access virtual visits. The PSR will use this new DAR to access virtual visits by selecting Rehab Virtual Visits in the DAR report. This report will display therapists' and generic providers' schedules. You can view or change the appointment information as necessary, which we will discuss in further detail later in this section. Once the DAR is complete for setup, continue with normal workflow of contacting patients who have messaged via MedBridge to schedule a visit. While on the phone, the PSR will need to determine if the patient needs a telephone visit or a virtual visit. Please use the scheduling guide below, which is included in your orientation package, for your reference and when you're scheduling patients. Confirm the patient has had an active MyHealth account. If they have, continue to schedule the visit in Epic. The PSR will always log into the Epic department shown here, titled SHHG Rehab Telemed. Open the patient's appointment desk by clicking Make Appointment. Please remember the day desired for the appointment is important. If the patient does not have an active MyHealth account, schedule at least 2 days out so they can activate their account. Once the home department of the patient is identified, be sure to schedule in the appropriate location. For hospital group patients, the department location will remain unchanged and proceed with the appointment notes and provider. For hospital group scheduling, in the appointment notes, indicate the Epic department where the patient's home or primary Epic department the patient attends therapy. You will also want to include the therapist being scheduled, any MedBridge messaging or pertinent info, and the type of device the patient will use for the visit. Choose laptop, desktop, or mobile device. The visit types will either be for telephone visit, using audio-only telemed, or for a virtual visit, use telemed specialty home EST. For the provider selection, select the appropriate generic resource from the list that the therapist is assigned. Please reference your assigned Epic department generic resource information if you're unsure of the assigned provider. This is also included in your orientation package. If scheduling within the medical group, you will need to change the department location to the specific location where the patient is seen. For a medical group patient, always choose the generic provider selection from the search menu. In the next screen, you will select the guarantor and continue to fill the remaining fields. At the end of the day, the PSR will need to access the DAR and change the appointment scheduled to the correct provider and department where the patient is normally seen. For medical group, you only will need to switch the provider considering the patient is already in the correct department. Change from the telemed department to the department where the patient is normally seen. Change the provider to the assigned virtual therapist where the patient is typically seen. Remember, your previous appointment notes will ensure the correct department and therapist. Your change reason, choose COVID-19, then click Accept. Once this is complete, you have successfully finished scheduling. In this section, we will cover the virtual visit patient setup. From a laptop or desktop computer, download Google Chrome browser. From a mobile device, download the MyHealth app from the iTunes or Google Play Store. Sign in to MyHealth via the mobile app or computer's Google Chrome browser with the hyperlink shown. The Telemed Specialty Home Established visit will be on the home page as an upcoming appointment. Select Confirm Visit, click on Consent to be treated. Once the consent is received by the patient, the blue Start Visit button will appear. 10 minutes before your scheduled appointment, click the Start Visit button. After the visit starts, you will be asked to authorize MyHealth to access your microphone and camera. Select OK to allow your camera and microphone to be on during the visit. A Spectrum Health employee face will appear on the main screen, and the patient will appear in the lower right corner, letting you know the connection has been established. To start the visit, click on the green phone button on the bottom of the screen. The green phone button will turn red when the patient is connected. After the visit is completed, press the red phone button to hang up.